Text: millions of people are living with an untreated mental health condition. This is Daniel's story. A woman sits beside a bookshelf. Next, a painting of a little boy. Then, the woman holds a photo of the boy and an older girl in formal wear.
He was so outgoing and everyone liked him, and he did really well in school, and the teachers always loved him.
A young man wears glasses and a button-up shirt. Next, an old photo of the woman, Daniel, and a little girl. Then, Daniel's photo in a school yearbook and a name tag.
We moved to Washington from Oregon when I was 11. And then from there, it just seemed really lonely. It was hard to make friends and just seemed to kind of go down from there.
I kind of noticed things happening around when he was 16. He would get really defiant when we were asking questions and wouldn't really give us direct answers and wouldn't tell us where he was.
I was very guarded, and it seemed that more and more of the anxiety was coming out.
Daniel sits on a bench on a dock, then walks away with his hands in his coat pockets. Next, Daniel drives, then shakes pills into his hand. A shot of alcohol is poured and picked up.
I just felt kind of lost, like not really knowing what the problem was, so I didn't really know how to address it. And the worse that got, the more I was self-medicating. Every once in a while it became like every day, and every day became like all day, and then it just became harder and harder to manage, and it just seemed to snowball.
Black and white video of driving, then setting a shot glass down on a bar.
And it just got darker and darker, and it was just, it didn't really seem like there was any way out. I just felt completely buried by it.
Daniel tilts his head.
And then it finally caught up with me.
One Saturday, I was in Portland with a girlfriend buying some school supplies, and I got a phone call from my husband, and he said that Danny hurt himself.
I felt that at one point, if I could push enough people away, that I wouldn't have to worry about it, that no one would miss me when I was gone.
So finally, I got it out of him that Danny had slit his wrist.
Photos and awards from Daniel's childhood. Next, a black and white video of Daniel outside. Text: unfortunately, Daniel isn't alone. Poor mental health is a major public health issue that robs millions of people of their chance to lead healthy and productive lives. Although most people never receive effective treatment, Daniel was lucky. He found Collaborative Care, a building on the corner of 19th and Republican. The sign above the door reads Country Doctor Community Clinic. Medical personnel work in the clinic.
Daniel was referred to Country Doctor, a community health clinic that practices collaborative care. Collaborative care provides mental health care in primary care and other familiar settings where most people already receive their medical care. It's a patient-centered approach that builds on the existing relationship between the patient and primary care provider.
A doctor sits down at a computer in an exam room where Daniel sits on the exam table.
Unlike usual care, collaborative care gives mental health care support to primary care providers by adding new members to the care team.
Text: Angel Mathis, primary care provider.
When I see a person in primary care, I have 15 minutes with them.
She and Daniel talk.
And it's very difficult to make a mental health diagnosis in 15 minutes. It helps to have somebody who has time to really fully assess a person's symptoms and get the correct diagnosis, and then work with a psychiatrist to get the best treatment plan.
Text: collaborative care team. Double-ended arrows point to and from primary care provider, care manager, and patient.
That person is the care manager, the third member of the collaborative care team.
To the right of the others is psychiatric consultant.
The care manager manages the overall treatment plan, provides brief psychotherapy proven to work in primary care, supports medication management, and facilitates communication with all members of the team, especially the patient.
Text: Annie McGuire, care manager. She sits in an office, then talks with Daniel. Next, dotted lines run from patient to psychiatric consultant, and primary care provider to psychiatric consultant.
Daniel was referred to me through his primary care provider, Angel, and he was having a lot of health concerns, but also experiencing pretty significant anxiety symptoms and ADHD symptoms.
The fourth member of the team, the psychiatric consultant, works closely with the care manager to provide a mental health diagnosis and speaks with a primary care provider or patient as needed. The psychiatric consultant and care manager work together to develop treatment plans, usually over the phone, using a caseload approach.
Text: Anna Ratzliff, psychiatric consultant. She writes on paper. Next, Daniel sits in the exam room with Dr. Angel Mathis.
My role is to be able to know what are the evidence-based treatments that we can use to help patients with depression. So one of the things I can do is have a variety of options for the primary care provider to try when patients don't respond to first-line treatment.
So she would make recommendations, and then my role would be to make sure that those recommendations were relayed to Daniel's primary care provider.
The fact that I could go to a checkup visit to see Angel and have her already know what Annie and I discussed was so much easier than me trying to remember with everything else going on, like, oh yeah, what did we talk about last week?
It helps me feel really confident in the diagnosis that is eventually given.
Collaborative care takes a population-based approach to mental health and uses a registry to track clinical outcomes over time of every patient being seen.
A spreadsheet labeled current patients. Patient information fills the rows. Next, several rows are highlighted.
This shapes the treatment plan and focuses attention on those patients who need the most help.
Anna types in the assessment and treatment recommendations section. Next, text. Treatment options. Problem-solving treatment, PST, behavioral activation, BA, motivational interviewing, MI, medications. Then, Daniel poses for a picture with the medical team.
One of the things that's really unique about collaborative care is because we do that tracking over time, we can actually kind of hold the memory a bit for patients sometimes and help them actually see their progress when they don't see it. So sometimes patients get stuck and they can feel like nothing's getting better because the work of changing is so hard. People can kind of want to give up.
Like sometimes they'll be like, I don't feel any better. It's like, well, 3 months ago, this is where you were. And this is where you're saying you are now. And that comparison is really helpful.
You know, there were times when he wasn't doing that well and he kept coming back anyway and hanging in there with us when we had to try a couple of different medications and try some different behavioral approaches to the things that he was struggling with.
Collaborative care offers a full range of treatment options that have been proven to work in primary care. For Daniel, a combination of psychotherapy and medication helped him get better.
You know, it's easy to try to put a Band-Aid over something, but I feel that if he didn't have the counseling, I don't think he'd be where he is today.
Treatment is a process, and there is still work to do. But since coming to Country Doctor and being a part of a collaborative care team, Daniel has made huge progress. He's doing well in community college and is enrolled in an externship program to become a medical assistant. Long term, he plans to go to medical school to become a doctor.
Daniel works at a laptop, then plays the guitar. Daniel and the woman make a recipe in the kitchen.
Collaborative care has been proven to be more effective than usual care in over 80 randomized clinical trials. And it achieves the triple aim of healthcare reform: lowering costs, improving clinical outcomes, and increasing patient satisfaction.
They smile and laugh in the kitchen.
It just feels like this huge thing is lifted off of all of us. He's finally become who he was supposed to be all along, and that's the neatest part.
She nods and smiles widely. Text. Collaborative care has helped thousands of people like Daniel take back their lives. Text. To learn more, explore the University of Washington's Ames Center website at www.ames.uw.edu. Daniel strums the guitar. Text. Ames Center, University of Washington, Integrated Care and Public Health.